Alrighty, here we go. Hello, everyone. My name is Dr. Marty Kotler. I want to thank you for watching this impromptu webinar I put together on telehealth, billing, and coding. The information I'm going to be sharing with you is in response to many chiropractors and integrated practices reaching out to us for assistance and guidance on telehealth, coding, and billing. And it's, is it even possible to get paid by insurance for these non-face-to-face services? Chiropractic is a very hands-on profession. So how can we utilize our services during this public health emergency and coronavirus outbreak? So all I'm trying to do here is help out as much as possible and provide good quality information as soon as possible for free. Today is March 23rd, 2020. Here's my little disclaimer. The information that I'm providing to you has not been vetted by an attorney. There are definitely legal implications to providing telehealth services. Target coding does not provide legal services. I've made every attempt to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Again, my name is Dr. Marty Kotler. I'm a chiropractor. I practiced for 16 years. I'm also a certified billing and coding specialist. I'm a certified professional compliance officer. And we've been helping hundreds of chiropractors over the last 12 years with coding and compliance and HIPAA and Medicare. And just to be clear, this webinar is not about making money. You can provide telemedicine services for free if you want. You don't even have to do them if you don't want to. You can charge cash, or maybe you want to just document everything and wait till the dust settles, and then maybe you'll be able to submit claims in order to get paid by health plans. I don't know, we'll see. So let's begin. Telehealth, coding, compliance, and documentation. So telehealth, telemedicine, telechiropractic, telechiro, I don't care, whatever you want to call it. This is an exchange of information that a provider and a patient is going to have. This is, these are non-face-to-face patient-initiated communications. And because of this public health emergency, all of these acts and rules and things have occurred. Some rules have been relaxed. A lot of things are under this 1135 waiver, which I'm going to be talking about for a few minutes. But there are three types of visits: telehealth visits, e-visits, and virtual check-in visits. Let's first start by talking about telehealth visits. This is where you're going to use some sort of audio video communication with a patient, real-time communication. The patient should be notified that these third-party applications could potentially introduce privacy risks. So we recommend you have your billing office manager or your compliance manager create an informed consent form. If you don't have one, we're going to give you a sample. I'm going to show you the one we've created for our clients. Show it to your malpractice and show it to your malpractice insurance company. So with these televisits, you should have a relationship with the patient. These should be used for established patients, but you could have a new patient contact you this way. So HHS said they're not going to be conducting audits to ensure if it's a new patient or an existing patient, the 3-year rule. So the communication technology platform that has been accepted to be useful is your typical FaceTime, Zoom, Skype, Google Hangout. It's all fine. The Facebook Live and TikTok platforms are not recommended. They are too much for public viewing. So the way these telehealth visits will be coded are through your regular E&M codes. But it's going to be based on counseling and coordination of care, where time becomes the key component. History, exam, if possible. I don't know if it's possible to do an exam through a Skype video conference call. Maybe you could see if a patient, if you could have them turn their head and see if, their range of motion is limited. I don't know, careful with that. Then you're going to have to make some clinical decisions. You should document these encounters very well. And If you haven't been doing them, we've created sample documentation for our clients on telehealth visits. So we're going to show you that in a few minutes. Now, HIPAA has relaxed the rules a little bit also because of this public health emergency. So they're going to be waiving penalties against providers for using open communications, like FaceTime and Zoom. Now, you should try and get a business associate agreement with these third-party applications. The OCR, that's the Office of Civil Rights, which oversees HIPAA, they have provided a list of vendors that they said will provide BAAs. So Skype for Business, Zoom for Healthcare, Google G Suite will meet these requirements. And there's a link there for more information. Also, a little bit about the OIG. They've issued a policy that stated that they're not going to penalize providers for waiving co-pays and co-insurance and deductibles. Again, if you're going to be billing for these services, there is no cost sharing necessarily on behalf of the patient. So you're not required to collect the copay or deductible. Now, CMS has also waived the requirements for out-of-state providers. So you may be able to do telemedicine with patients outside of your state, as long as you're licensed in one state. Next, e-visits. So e-visits are also non-face-to-face communications that you can have with patients, but they have to be done through an online patient portal. So this is different. You'll need to contact your certified software company and get started with the online patient portal. If you want to bill for e-visits, there are the codes 99421 for an e-visit through an online patient portal for 5 to 10 minutes, 99422 for 11 to 20 minutes, and 99423 for 21 or more minutes. A little bit more about e-visits. You have to have an established relationship with the patient. This is where the patient can communicate with you without having to come to your office. You can put out information to your patients, letting them know that you're going to be offering this service. Now, there are providers that are not able to bill for E&M codes. Like who? Physical therapists, occupational therapists, speech language pathologists. So there are codes for providers who may not independently bill for E&M services. So the first code here is this is a HCPCS code, G2061, 5 to 10 minutes, G2062, 11 to 20 minutes, G2063 for 21 or more minutes. Next, we have virtual check-in visits. So this is a brief communication that could occur by telephone or through video. You may need to educate the patients on the benefits of doing this type of communication. These are virtual check-ins. Actually, Medicare pays for these virtual check-ins, not to chiropractors at the present time. The patient has to verbally consent to receive these virtual check-in visits. So again, these visits can be phone or through Skype or Zoom. And the code is a HCPCS code, G2012, brief communication, 5 to 10 minutes. Now, there are instances where patients will, they may, not sure if this is going to happen with you, where a patient may want to submit information to you. They might want to send you their lab work, their x-rays, their MRIs to review. So if you're going to spend time reviewing and interpreting that information, that's G2010. So now, as far as billing for these telehealth services, again, you don't have to do these if you don't want to. You may want to offer these because your practice is only open part-time. If you're seeing patients full-time in your practice, maybe you don't want to get involved with this. So this isn't for everybody. And again, you might not want to bill for these. Now, if you decide you're going to bill, this is the way it should look. The place of service, that's the key thing that has to change on the claim form. The place of service is 2. Typically the place of service is 11 for the office, 12 for home. There's many, many different types of place of service codes. So for telehealth, there's a few examples there. The place of service in box 24B has to be the number 2. Now, there are other services like telephone services performed by providers that could bill for E&M services like chiropractors and medical doctors and nurse practitioners and osteopaths. These are non-face-to-face telephone services. CPT code 99441 for 5 to 10 minutes, 442, 11 to 20 minutes, 443, 21 to 30 minutes. And there are telephone services that are provided by non-physician providers, non-face-to-face telephone services, non-physician, CPT code 98966, 5 to 10 minutes, 98967, 11 to 20 minutes, 98968, 21 to 30 minutes. And then we have qualified non-physician healthcare professional. These are online digital E&M services through Skype, Zoom. These are for non-physician healthcare professionals, 98970, 5 to 10 minutes, 98971, 11 to 20 minutes, 98972, 21 or more minutes. Now, these are brand new. These haven't been vetted too deeply, so there isn't too much information for me to give you on these. These were brand new as of January 1st, these telephone codes. So, here's the sample telehealth informed consent form that I wanted to provide. If you want to if it's hard for you to see this, just send us an email and we'll get it to you. It says, notice to patient, telehealth, telemedicine related terms refer to the exchange of information. These are non-face-to-face patient initiated communications. And then there's an acknowledgement. I understand the concept of telemedicine and the particular electronic format this office uses. I understand there's been great advancement in telemedicine technology. However, there may be problems. I understand there may be limitations beyond control. I may need to seek face-to-face encounter with another healthcare provider instead of accepting these telemedicine visits. I understand that these visits may only require one-time occurrence and follow-up treatment may require face-to-face. I understand the specific procedures may require additional informed consent process. I understand there are no guarantees with telemedicine. And here is a sample telehealth SOAP note. Example, a telehealth visit was initiated by the patient today. The patient verbally agreed to the treatment in this remote fashion, also reviewed our telehealth informed consent form. The patient's complaining of pain in the neck, upper back, tension, headaches. The patient feels these complaints are probably due to anxiety and stress from the coronavirus health emergency. The patient does not have a sore throat, fever, shortness of breath. The patient has been coughing more than normal. The patient has a history of a neck and upper back pain and has been actively seen for these conditions in our office prior to the coronavirus outbreak. The patient stated the neck pain is pretty bad. She gave it a pain scale of 8 out of 10. The patient was given the preliminary diagnosis, home care instructions, and recommendations were made, like ice, heat, stretch, exercises, rest. The patient was given the opportunity to ask questions and all questions were answered. The patient was advised to call 911 if deemed necessary. The technology platform used was Zoom communications. Total time spent for this encounter was 15 minutes. Make sure you sign and date the note. So here's a couple of action steps. Number 1, notify patients about the benefits and availability of telehealth services if this is something you want to offer. Go over appointment scheduling with all your doctors and staff. Choose a platform. Check the health plan policies on telehealth. United Healthcare, Blue Cross Blue Shield, they've come out with them already. And we're going to be going over those in the next update. We're going to go over some deeper information here. Insurance companies, regular commercial insurance companies have been requested by the federal government to expand their telehealth policies. So if you're going to submit claims, try to verify coverage prior to billing. Ask your billing company to get involved and assist. Contact your malpractice company about coverage for telehealth services and obtain a telehealth informed consent form. Now is the best time to catch up on target coding, billing, and coding videos. instead of binge watching Netflix all day and all night. You may want to use our target coding videos as a distraction and catch up on things. So just a few closing comments. In our next webinar, next update, we're going to get into more specific fees for these codes and which companies are going to cover them and which codes are not going to cover them, how to use these codes per health plan. So here's our contact information. We offer free consultations if you have questions about this topic or anything to do with billing, coding, Medicare, HIPAA. Send us an email and then we'll send you a little link. You'll pick a time for a free consultation with me or one of my staff members. There's our contact information: email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. That's our HIPAA secure fax number there, 1-844-831-2347. Please check out all of our Instagram feeds. Follow us on Facebook, YouTube. We're going to be posting all of this stuff on our social media platforms, so you'll get it instantly when we post it. So again, I want to thank everybody for attending. I hope you learned a lot. Take care, everyone. Bye-bye.